Well, it's my pleasure to have with us in this series I'm calling Reflections from Pharmacy Leaders Advancing the Profession, Dr. Henry Manassas, who has served in leadership role in academia and also in health system pharmacy. He's professor and Dean Emeritus at the University of Illinois at Chicago. He previously served as an executive vice president and CEO of ASHP. And prior to that, in many previous roles, and administrative roles, like at Iowa and the University of Illinois at Chicago. He was awarded honorary membership in ASHP. He's a past president of AACP and has been elected to IOM, the Institute of Medicine of the National Academies of Science, and has also been the recipient of the ASHP Harvey Whitney Award Lecture. He has written books on medication safety, a guide for healthcare facilities, and one thing I did not know, but he was the first PhD graduate of the University of Minnesota's Social and Administrative Science program. So welcome, Dr. Manassas.
Thank you, Terry, very much.
Okay, we'll start off with, we'd like to learn more about your journey and your position and recognition as a leader. And when reflecting on your journey, you may wish to include key events or people that influence you in that journey.
Well, let me begin by saying that I've had a wonderful career, and I appreciate the opportunity to do some reflections in this conversation. I would also say, maybe as a precursor to what I'm going to talk about, is that I've had the opportunity to work with a lot of really good people. And I think most leaders, in reflecting on their career, would say they all stand on the shoulders of giants, if you will, and they never did whatever they might have accomplished on their own, that they've always had partnerships with colleagues and working together in a common vision. I've had a wonderful career, sort of unusual, being able to spend about 28 years as an academic, and then almost 17 years as the CEO of a national professional association. That's a really interesting combination. I started my journey based on my students' days, and Terry, you may remember there was a time when we were legally required to do apprenticeships. These were state requirements that were not qualitative, they were quantitative, meaning that in the state of Illinois, for example, and I think it was true around the country, the model of learning by apprenticeship was a legal requirement, and you had to complete 52 40-hour weeks of an apprenticeship. There was nothing in the law that said anything about the content, about the supervision, about the quality, about the mentoring requirements, etc. And as a student, I was sort of active in questioning whether that's the right model for professional education, particularly given the intricacies of practice and the importance of structuring practice experience from an educational point of view. So we, as students, started agitating and called this into question. And when I graduated, the dean of the college, who of course I had many conversations with, that being Dr. George Webster, said, you know, we'd like to have you come maybe work part-time at the College of Pharmacy at the University of Illinois and work at this question of getting rid of apprenticeship and moving to an educational model really for experiential training. And I agreed. I had another job actually working in a small manufacturing facility, but I wasn't married at the time and had a little extra time. So I worked on this issue by forming the Illinois Academy of Preceptors in Pharmacy, and we recruited a cadre of pharmacists in practice who agreed with our notion that we needed to construct the practice experience from an educational model. And we also needed eventually to work with our legislature to remove the apprenticeship requirement as it was stated. And we would actually integrate experiential education into the curriculum. This was, of course, unheard of in the late 60s. This was sort of a radical idea. But anyway, that's kind of how I got my start. And as I was working in this, I got really interested in education, maybe as a theoretical concept, but also as a area of learning. So I went to graduate school at Loyola University and did a Master of Arts degree actually in educational psychology, and then left the University of Illinois in 1972 to go to University of Minnesota to work on my PhD. And I was in the mostly social science areas, and I ended up doing my PhD work on studying the personalities of people attracted to pharmacy, as well as academics and practitioners, and looked at the whole issue of professional socialization. So from a scientific point of view, I'm a social scientist. In any case, when I finished, I was recruited back to the University of Illinois, and in 1974, we got a substantial federal grant to study self-paced and self-instructional education. This was way ahead of distance learning and online learning, if you will. We got a federal grant to experiment with a totally self-paced, self-instructional curriculum that would be based on the achievement of competencies rather than the end of the semester. So students, everybody has a different learning style, and that learning style could be accommodated by freeing up the calendar, so to speak, and really focus on competencies. And when you achieve the competencies, then you move on. So theoretically, you could go as slow or as fast as you wanted in that curriculum. So I was the principal investigator of that research project, and for 5 years, we ran a parallel, totally self-instructional curriculum. And I was, of course, interested in the socialization questions around that. And we published quite a few papers, some books on this area. And, you know, I thought my career was going to be in this area. Well, in 1980, Dr. August Lemberger, who was the dean at that time, decided to leave the University of Illinois, and I was asked to be acting dean. And that got me into the administrative model. I wasn't really looking to be a dean because I really enjoyed my research activity and my teaching activities. But in any case, you know, you're called to service, and I became acting dean, and then eventually was appointed full-time as the dean. And I was dean then for 13 years till 1993. And I would say probably the most important aspects of my leadership there. First of all, we fully integrated experiential education into the curriculum, and we were successful in getting the legislature to remove the apprenticeship requirement. And again, I did this with lots of people. We got that done. But then I also felt very strongly that the profession needed to move clinically. And while we had a post-baccalaureate PharmD degree program, my view was that we will never produce sufficient numbers of pharmacists who have clinical experience and capabilities unless we went to the Doctor of Pharmacy degree as the entry-level degree. This was, of course, at that time, extremely controversial. You lived through that time, Terry. But in any case, in 1983, the faculty at the University of Illinois made the decision to only offer the Doctor of Pharmacy degree as the entry-level credential. Now that posed an interesting question for those pharmacists who were in practice. And there was a clamor, basically, what are you going to do for us? We also need this clinical education, and you know, we haven't been out of school all that long, or I really want this kind of background. So our experience in offering a totally self-instructional curriculum opened the pathway for what we call the continuation curriculum. So pharmacists in practice essentially could come back to school, take additional coursework, totally self-instructional, just like what students are doing these days on online instruction, and complete a year of clinical education under the supervision of the school and receive the Doctor of Pharmacy. And that program went on for probably 15 years or so until all the practitioners who were in practice who wanted to get the PharmD degree were able to get that. That took an immense amount of leadership, as you might imagine. Not only was it controversial, but it was complicated. And in a faculty to construct a new curriculum, and I insisted as dean, I didn't want to rework old curriculum. We really needed to rethink the role of the pharmacist and the skills that pharmacists needed for the future, thinking, of course, that we're looking at a 40-year career for most pharmacists, maybe 50 years, and we really have to be forward-thinking. And again, reflecting on how many people it takes to get that done. We really had a good visionary dialogue among the faculty, and we got the job done. And we were the 6th school of pharmacy, actually, in the United States to do this. And I think over the years, in reflecting in that decision, it was the right decision, because in 2000, eventually all the colleges of pharmacy were required to go that direction. Well, there was another incident that occurred during that time. Of course, an immense amount of change in healthcare over the time, and the University of Illinois has a health system and hospital and clinics, and very active in providing care in the city. And in 1988, 89, there was a financial crisis, and the university officers thought it would be a good idea to sell the university hospital. Well, this was a huge issue, became a particularly problematic issue for me, because the College of Pharmacy, it's unique in this way in the United States, operates all the pharmacy services for the hospital, for all the community-based clinics, for the student health service, for the outpatient ambulatory center. And to think about that this would be removed from our responsibility, it created a huge issue, because we used all those facilities for our clinical training. And I personally believe our accreditation would have been in jeopardy had we lost as well. I became a very vocal critic of the university leadership in wanting to do this, and along with some of the other deans in medicine and dentistry and nursing particularly, we became quite vocal. And in being vocal, I guess I became a little bit more known across the university as well as in the city, because this was a big issue for the city and ultimately for the state legislature. And being a critic, I was interviewed quite a bit, and I got a lot of visibility. Well, the vice chancellor for health affairs at that time, unfortunately, passed away. And he was another wonderful mentor of mine. He was a former Food and Drug Commissioner, Alexander M. Schmidt, and he passed away, and created a vacancy for the Vice Chancellor for Health Services. So the university president asked if I would take on that job. And that's a very different job, obviously, than being Dean of the College of Pharmacy, having to rebuild our health system after all that controversy was sort of my major task. And I set out to do that with the colleges and, of course, with the leadership of the hospital and the health system. Well, I did that until 1993, when I was recruited by the University of Iowa to be their first vice president for health sciences. And the idea was that there would be a university officer for the first time at the University of Iowa who would bring together all the health sciences, all of a very expansive health system and hospital, and in the state of Iowa, also the state health department that was part of the University of Iowa, the laboratories, and including all the public health programs. So I would say my major accomplishments there were to really focus heavily on interdisciplinary education and bring all the health sciences deans together to focus on interdisciplinary education. We were able to get funding from the legislature to experiment in several communities in interdisciplinary education. And I think we also ended up writing some papers. Was a staff person in my office that did a PhD dissertation on this. And I think in all that work, it was my view that the state of Iowa needed a school of public health. rural health is a very different issue than urban health, which of course heretofore was where I was involved. But there are lots of issues associated with environment, with safety, particularly in farming equipment and animals, and environmental questions of fertilizers and et cetera. And then, of course, child safety, particularly in farms, is a big issue in rural areas. Um, so I felt that if we established a school of public health that would focus all of the university's efforts on some of these major issues, and it would establish kind of a unique contribution. So I was heavily involved in getting that moving. And then I was recruited by the National Professional Society, ASHP, to be their CEO. And at first, it wasn't terribly attractive to me. I was an academic, and yet when the board and I met, they said there are two major issues that we're really interested in that we believe you could help us lead. One is, again, interdisciplinariness, having a better connection with the other health professions, because that teamwork in care and the role of the pharmacist as part of teams is a very important challenge in healthcare quality. And the other issue was to become more engaged in the public square from a public policy point of view. And of course, in my work both in Chicago and in Iowa City, I was very much involved with our legislative leaders and had experience in that area. So after a few months of saying, am I ready to change my career? I accepted the job and went to work at ASHP. And in reflecting, Terry, what I think maybe my major accomplishments were there and might have a longer lasting legacy, certainly patient safety. We were brought to the table, fortunately, early on after Dr. Lucian Leaf's paper hit the New England Journal of Medicine. And since I was also a member of the Institute of Medicine, I was very much involved in a lot of dialogue around patient safety as the Institute of Medicine began to tackle this question of patient safety. I think also the interdisciplinariness, we developed a very good relationship with medicine, probably more with the specialty societies rather than with the AMA, for example, although we had good relationships with AMA, and nursing. We looked specifically at nursing and medicine, and also executive leadership in hospitals and health systems. And over all those years, I sort of ended up on a first name basis with a lot of leaders in not only the other health professions, but also in the executive leadership and accreditation of hospitals. I would say the last thing was that I raised a lot of questions about how should we most effectively use this talented person we call the pharmacist in hospitals and health systems. And when you looked at what pharmacy did or was responsible for, there are many aspects of that practice that can be done by people who have less education, less training. We call them pharmacy technicians, for example. And since pharmacists are such a scarce resource and in many cases an expensive resource, I think we were obliged to sort through what should pharmacists be doing. And we tried to answer that question by hosting what we call the Practice Model Summit. And we did that in Texas. We invited leaders of hospital pharmacy from all over the country. And in so doing, we had several days of discussion on the question of what should pharmacists be doing. And that was the beginning of what now is this practice model initiative. I think it's called the Practice Initiative now, because I think the question is still, being examined and answered. But I found the ASHP position to be a wonderful place to deliberate policy clearly, but also to provide leadership. And reflecting back on it, it was a very enjoyable years. I've since retired in 2012, and I volunteer now as a professor at the University of Illinois, and I kind of do what I want to do. which is what I like to do. Most of my work is, they're on the counter. Most of my work is supervising students who are doing independent study, and we're doing all kinds of interesting projects. I give an occasional lecture. Don't do too much writing anymore, but I'm still concerned about the issues of the profession. I've probably gone on longer than you want.
Well, that was very good. You really addressed your legacy and your contribution. So I think you embedded that quite well. So I'm going to move on to advice to students in their professional journey as they develop as leaders to advance the profession. And again, just a few words of advice. I know you have a lot to say.
Sure. Well, actually going back to one of my mentors, and this might sound strange, but Dan Nona was a professor of mine, and he talked one day about a quote by Francis Bacon. Francis Bacon was an attorney and philosopher, but he wrote these words, essentially saying that professional people are debtors to their profession, that a profession gives them a livelihood, it gives them status in the society, it gives them opportunities to do things that others in the society can't do. But you then have a debt to that profession. And that it really impressed me. And I think to this day, my advice to students is, you have an obligation to be custodians of this profession and make it better for the future, always thinking about how can we improve patient care. And I would also advise, strong passions around what can we do to make the life of the patient more safe, more maybe predictable in terms of the therapies that we're using, but also that we have an obligation to assure those patient outcomes. And between being obligated to the profession, I obviously advocate being involved in national associations. They're the people that are doing the work, they're pushing. And we don't have enough pharmacists participating in our national associations. And I think you do have a debt and an obligation.
That's great. Excellent. Great words of advice. And my final question, as this isn't, these interviews will be embedded in a history course, as we study the decade of the 2020s, one of the key event in that decade will be the COVID-19 pandemic. Like other key events in our history, events external to us shapes our profession. And not only does it shape it, but it will also create opportunities for our profession. Can you comment about that? How you see that?
Yeah, and I think that's a really important issue, Terry. And one of the things that I found out early on, because being in the state of Illinois, there was a call for all health professionals in the state, even if you were retired, to come forward and offer your skills if the state needed them. Mm-hmm. And I found out in that call that pharmacists are not designated as emergency personnel. I think that's a huge public policy problem for us as a profession. And I hope that the profession, after the epidemic is ended, that they go back and study this question and make sure that pharmacists are designated as emergency personnel, because we all know that the integrity of the drug supply, the availability of medicines is really crucial, particularly if patients are hospitalized. If we end up with a treatment, the availability of medicines is important. But even more important is, I think we have learned that we were absolutely not prepared for both the extent and the seriousness of this particular virus. And I think once vaccines and or treatments are available, that will give us an opportunity to at least manage the disease, manage the virus. But we also have to think about what do we need to do at the local, at the state, and at the federal level to plan for these events. And it's not too early for us to seriously look at that, because there may be a resurgence, right? We don't know that yet, but there may be a resurgence. We're going to be caring for patients who are infected. And we need to know the disease, the nature of the disease itself, and its treatment and its management. I think the other is the whole issue of testing and the utilization of pharmacies for testing and guiding and counseling patients through what that data might mean. And again, we have a lot of questions yet unanswered. But as pharmacists, I think we need to pay attention to the scientific literature, obviously, about testing. And eventually, if we have better testing methods and have better antigen and antibody understandings, I think we can be much more prepared.
Very good. Well, I appreciate it. Thank you very much for your time and your insights. It's always a pleasure.
Well, I've enjoyed this, Terry. Sometimes, it's kind of fun to reflect on the past.
Absolutely. Thank you very much.